Good evening, and thank you for joining us for this live Facebook event. This presentation is brought to you by Covenant Consultants. I am Cheryl Haynes, owner of Covenant Consultants in Tallahassee, and I am your host. As part of National Council on Aging's National Fall Prevention Awareness Week, which is September 21st through 25th, this event's purpose is to bring awareness to the subject from a local level. We have assembled a team of experienced presenters who will share their expertise so that after this event, you will leave knowing how to reduce your risk for falls, or if you do fall, how to go about getting the care that you need. Here are the presenters for this evening. First, we have Leah Baynard.
Good evening.
Leah is an occupational therapist and part of the Covenant team. Leah is a graduate of Florida A&M University with 13 years of experience. Leah holds a doctorate of occupational therapy from the University of St. Augustine for Health Sciences, where her graduate research addressed fall prevention among community dwelling adults. She brings a strong perspective regarding the subject this evening. Next, we have Elena Steeple.
Hi.
Elena is a board-certified primary care registered nurse practitioner. Elena works for Neighborhood Medical Center, a community-based medical practice in Tallahassee, Florida. Elena is a graduate of Florida A&M University's Nurse Practitioner Program. She is also a graduate of the University of North Carolina at Chapel Hill and a licensed speech language pathologist. Elena has a unique perspective of the rehabilitation process, and I look forward to her bringing her perspective on the subject. James Sina Montgomery.
Good evening.
James Sina is a pharmacy manager for CVS Target in Tallahassee. James Sina holds a doctorate in pharmacy from Florida A&M University with 25 years of experience. James Sina has a unique ability to connect and communicate with the customers that she serves. I asked that she join us this evening because she is my go-to for all pharmacy issues for my family and friends. Bernard Smothers.
Good evening.
Physical therapist with 27 years of experience. Bernard currently teaches in Florida A&M University's Doctorate of Physical Therapy program for the past 14 years. I have known Bernard personally for over 20 years. He has worked in a variety of settings and worked with patients across the lifespan. Sherry Lyles.
Hi.
Sherry is a social worker. She's a graduate of Albany State University with a degree in social work. She has over 20 years of experience working within community health organizations. Sherry has been my go-to person when I've needed to identify resources for patients, and she has a vast knowledge of where to find services. Barbara Kornblau.
Hi, everybody. Nice to see you all.
Barbara's an occupational therapist. Attorney, and educator with over 30 years of experience. She's a graduate of the University of Wisconsin-Madison and the University of Miami School of Law. When I think of Barbara, I think advocacy and education. Barbara has expertise in laws that affect people with disabilities, and she will share that with us this evening. Barbara teaches in the Florida A&M University's Masters of Occupational Therapy program in Tallahassee, Florida. On a national level worth noting, she is a past president of the American Occupational Therapy Association, which currently has a membership of 60,000. The format for this evening will include presentations from each professional. At the conclusion, we will have a question and answer period, which questions can be submitted by Facebook or Zoom chat. And there will be some limited questions by phone. I'll start the presentation now. Just a little bit about Kavanaugh Consultants. Kavanaugh Consultants is owned by me, Cheryl Haynes, and I'm an occupational therapist. I have over 27 years of experience. We are headquartered in Tallahassee, Florida, and we do provide services in North Florida and some South Georgia regions. We focus primarily on senior care, and we provide specialized services such as fall safety, low vision therapy, and home modification needs. So we'll begin with our panelists, the first will be Dr. Leah Baynard.
Good evening again, everyone. I will be talking with you tonight about your risk for falls. So again, we just want you to be able to submit your questions if you have any. You can do that through the Facebook or Zoom chat box, or you may call in at the number 850-727-0125 and submit your question to a panelist. So let's just get started. While we're doing this, I want you to consider if you are at risk for falls. And some questions on here. This tool can be found at the National Council of Aging organization. And it's a checklist, and it's very simple to use. It's yes or no, and you tally up your score. Some of the questions include, have you had a fall in the past year? Do you feel sad or depressed? Are you unbalanced? Are you walking, holding on to things? And so some of these may be risk factors for falls. So when you look at this, if you score more than 4, then you may be at risk for falls. So just take a look at this whenever you get a chance and just kind of consider some things that may be going on with you during this presentation. If you have any questions, again, submit those to the comment box. Just a little background. First off, what is a fall? A fall would be a person coming to rest inadvertently on the ground or floor or lower level. So what that means is if you trip over your pet in the house, that's a fall. If you are sitting on the bed and you slide down to the floor, that is still considered a fall. Although you may not have hurt yourself, if you went from the bed to the floor, it's a fall. Every year, 30% of community dwelling seniors fall. And that is about more than 30 million people a year that fall. And among that group, if you are 85 years old and older, you have an increase, even more increased risk of falling. So what happens when you fall? So everyone is, I'm sure, familiar. If you fall, you may break a limb. You may, have bruises and a concussion, anything like that with a fall. But what I want you to also think about when you fall are those psychological factors that may happen. And that is what's called the fear of falling. So the research demonstrates that 20 to 60% of older adults develop a fear of falling after they have had a fall. And what happens with that is, with that fear, you limit your activity. And when you limit your activity, that leads to muscle weakness, poor balance, deconditioning. And so you want to decrease your risk for falls as much as possible so that you don't also create this psychological fear and limit your activity. What causes falls? Why are we falling? So we have what's called intrinsic factors, and these factors are due to age or disease-related changes within the older person, and these risk factors are considered unavoidable. So if you have like high blood pressure, a walking impairment, or even, like we said, the psychological factor of fear of falling, all of those are considered intrinsic factors which are unavoidable. So extrinsic factors, this is our second group. The extrinsic factors are those factors that can be changed to reduce your fall risk. And these factors are avoidable. So if you're in your home and you have clutter, or you have decreased lighting, improper footwear, pets, anything that we can change, then these are going to be your extrinsic factors. Why occupational therapy? So the goal of occupational therapy in this setting of community developing adults is to keep you at home. And our job is to make sure that you are safe and independent as much as possible when you are at home. And so occupational therapists, we have a very unique and qualified way to address falls, because we understand what's considered occupational performance. And so no, you know, a lot of times when you hear occupation, you want to say, no, I don't need a job. Well, that's not what we're here for. Our main purpose is to, when we say occupation, it means it involves your activities of meaningful activity to you. So if that means you need to get dressed and get out of the house, or if that means you need to be able to cook in your home, it's those activities that are meaningful to you in your life. So that is why we come in and we want to keep you at home, because we want you to enjoy those meaningful activities at home and enjoy them safely. Common recommendations. So first off, let's just say, you know, if you have a condition or an illness or disease, all of these recommendations may help you, but you need to have someone to come in and evaluate you in order to make sure that these recommendations fit appropriately for you and your situation. Everything is individualized, but these are just going to be some common recommendations that I'm going to go over this evening that will help keep you safe at home. So the first one is home modifications, and excuse me, home modifications with safety bars in your home or a ramp access. So the research recommends that the installation of safety bars or grab bars in the bathroom for safety and to be able to get in and out of the shower safely to reduce your falls. It is recommended that you install at least 2 safety bars in your shower or tub. Other bathroom safety equipment includes like shower chairs and shower benches. And the reason that is because 30 to 70% of falls that occur inside of the home happen in the bathroom. And a lot of times, unfortunately, it's because we have the inability, or the patient has the inability, to successfully move from one surface to the other, or especially a wet surface. So 70% of those falls come from the inability to actually get in and out of the tub or shower. So we always recommend some form of seating device, whether it be a transfer bench, which is located on the bottom of the slide, or a shower chair, which is at the top. Other recommendations include toilet seats with rails, or a toilet raiser, which makes your toilet seat actually higher so that you're able to get up and down from that surface a little bit easier. Lighting is also very important when we are talking about reducing falls, because The visual system is an important role in controlling balance for older adults. Low light levels often contribute to changes in the older person's posture, walking patterns, balance, and reaction times, which in turn can lead to slips, trips, or falls. Some common lighting recommendations include night lights to increase your lighting at night, and we'll talk about some other lighting like in the kitchen where you can do some other lighting there. Next, which is a very important one, is footwear. Recommendations for footwear. A lot of people fall because they wear improper shoes. So footwear is very important in fall prevention because shoes influence postural stability and how we maintain our posture. They help provide the sensory feedback to the ankle and foot that helps us keep our balance. So up top, you'll see some shoes that have good soles on them, rubber soles, non-slip soles. At the bottom, you want to avoid high heel shoes, flip-flops or beach shoes, slippers that do not have a back or that don't have very good grips on the bottom. So at the top, just keep in mind, you know, you want a good shoe when you're walking around your house or even outside, because 45% of falls in the community, dwelling adults, result as wearing improper footwear. Common recommendations for kitchen safety and fall prevention would be to add some lighting in the kitchen. You can put the underlights under your cabinets. You can also use what we call a reacher or a grabber. I'm sure some people are familiar with those that help you pick things up from lower surfaces or higher surfaces. So those are some safety recommendations for the kitchen. For the bedroom safety, that should say bedroom safety, we recommend that you add a safety bar to your bed, or also use a footstool if you have higher beds, you know, that you have a hard time getting in and out of, because falls increase with the inability to touch the floor while sitting on the edge of the bed. So if you're able to use your footstool in order to put your feet on it when you're sitting edge of bed, that will also help decrease your risk of fall. Some common recommendations for your steps and stairs. You want to consider getting the skid guards for outdoor steps, or even for some of your flatter surfaces as well. Like if you have areas where that gets wet when it rains and it gets really slick, you may want to consider getting your skid guards on your doorsteps or by your entrance to your door to help keep you from falling there. And these are just some references from this presentation. Next, we will have Ms. Elena Steeple, nurse practitioner, who's going to talk about the truth about falls.
All right, good evening. Like Dr. Renard said, my name is Elena Steeple, and I just wanted to put forth another reminder that if you do have a question or a comment, to please submit that question or comment to either Facebook or Zoom, or you can even call in at area code 850-727-0125. A representative will answer the phone, take down your question or comment, and present it to the panelists. Before I get into the meat of my presentation, I just want to kind of get our brain juices thinking tonight. So I just decided just to come up with, or even think about whether or not something is a myth or truth. Because we all know that if we talk to our best friend, who talks to our best friend, who talks to my second cousin, we know that there's a truth that somehow turns into a myth. So the first statement is, falling is something normal that happens when you get older. Second statement, is that a truth or a myth? Second statement, if I limit my activity, I won't fall. Is that a truth or a myth? Last statement, using a walker or a cane will make me more dependent. Now, several of these questions, these statements have already been answered from Dr. Bernard's presentation, but there'll be answers at the end of my presentation, okay? So, when we're looking at the risk factors, now, Cheryl was exactly right. I do have a unique perspective coming into this. So my first profession, which I absolutely still love, is speech language pathology. And when I was in school, we had the opportunity to, let's say, fine tune our observational skills. And because of that, those skills have actually helped me out being an advanced practice registered nurse practitioner. So let's say when someone comes, if I know that a particular client is coming into the clinic, I will actually peek my head out of my office and I'll just observe them. I'll observe them walking down the hall. I'll look to see if there's any, let's say, lower body weakness, and that lower body weakness can actually transfer into possible difficulties walking. I'll look to see whether or not they're leaning or they are favoring one side over the other, which could compromise their balance. And so, when they come in, I want to see where they're sitting. Are they sitting in the chair or are they sitting on the exam table? Because we're human beings. We're going to take the path of least resistance. So several people will take the chair if they're advanced in age. And I also want to make a brief point. You do not have to be over the age of 50 to have a history of falls or to be at risk for falls. You can have, like she said, you can have a disease process, something going on, an electrolyte imbalance. So I just want you to keep that in mind. And so I will ask them when they come in to see me on their appointment, to always bring their medications. It's really interesting. People will bring in their medications, and I ask for the medication, the appropriate medication bottle to be brought in. But not only will they bring in their prescription medications, but they'll forget, and they will sometimes put in their supplements that they didn't tell me about, vitamin supplements or herbal supplements. And I'll go through the bag and I'll look and I'll say, wait a minute, when did you start taking this? When did you start taking Sominex for sleep? Oh, did I leave that in the bag? That's what they'll say. Or they'll put in their St. John's wort. And I'll go, St. John's wort, that's for someone who is feeling like they're depressed. When did you start taking this? Melatonin, over-the-counter sleep aids, St. John's wort, or even if I prescribe the antidepressant, can all compromise a person's ability to walk safely. Then I'll look through their chart. I'll be talking to them and I'll look at their preventative tasks, their tab in the electronic medical record. And I'll say, hey, when did you, last time you had your dental appointment? And then I'll move down, I'll say, oh, wow, it's been about 5 years since you had your vision checked. When's the last time you had your vision checked? Well, this is what I want you to remember. Please do not cast vision or dental aside because you think that it's not as important as the heart or lungs. All areas of the body are very important. And so if I see that they have not had their vision checked in a number of years or even 2 years, that's reason for suspect. But not to mention, remember I told you I observed the person walking down the hall. I will look to see whether or not they're favoring a leg or even a foot, have a foot that aches them, or they're having poor foot pain. I remember this one patient, he came in and I didn't see him walking down the hall. I only saw his back going into the exam room. But when I walked into the exam room, he was sitting on the exam table and he had his foot propped up. And he had the side of his big toe cut out of his shoe. And so I said, well, that's interesting looking footwear. And he said, well, you know, I got this area on my foot that's very, very painful. And when I had him take off his shoe and his sock, I noticed that his other toes were discolored. That, of course, led me to perform a foot exam, which led me to perform a diabetes A1C check and come to find out that he was a diabetic. Unfortunately, did not know it. Now, from that, I mentioned about the diabetes lab exam, I will also check vitamin D. Vitamin D, very, very important. There is this unique relationship between vitamin D and the muscles and the central nervous system. Now, so when somebody comes in, I talk to them, but I'm observing them at the same time. I'll look and I'll say, next slide. I'll look and I'll say to them, you know what? Let me do a fall risk assessment on you. And they'll say, why? Why? Well, because, you know, when I was taking off your shoes and your socks, I noticed that there was this kind of black and bluish mark that was on your lower leg. Can you tell me about that? Well, I kind of fell. So, you know what? That's why I'm going to do what's called a fall risk assessment. Now in the clinic, I love to use the Johns Hopkins fall risk assessment tool. See, Dr. Baynard, actually, she does a fall risk assessment, but she wants you to answer the questions about yourself. Well, guess what? The Johns Hopkins fall risk assessment tool is me looking at you as the patient in the 7 areas: how old you are, your fall history, your elimination, bowel and bladder. Believe it or not, some people are racing to the bathroom or to the restroom, and they gotta go because they don't want to urinate on themselves, or they don't want to have a bowel movement, they don't want to have an accident. So I'll look at that. I'll look at their medication, like I said, over-the-counter sleep aid, or whether or not I prescribed an antidepressant or a neuroleptic, which is something such as gabapentin. If you have that neuropathic, that nerve pain at the bottom of your feet, I'll look at your patient care equipment. Are you coming in with a cane? Did you borrow that cane? Are you going to ask me for a possible rollator? Looking at your mobility, like I said, is the lower body weakness and the cognition. That is huge. A lot of people are wondering, what does my cognition, which is the speech therapist part of me, what is the cognition of the individual? Can they follow, make 1-2 step commands? Are they able to understand when you are putting your striking your heel and putting your toes down, how it comes down to knowing the sequence of walking. Cognition is a huge, huge factor on the Johns Hopkins Fall Risk Assessment Tool. Next. And so with that in mind, I look at this fall risk assessment, and guess what? I pull up my chair, 9 times out of 10 it's a stool, and I'll sit down and I'll go over it with them. And I will take their bag of medication, and I'll do what's called a medication reconciliation. I'll sit down and I will look at the bottles that they have, that the patient has in his or her bag, versus what I have on my computer. And guess what? There's a good chance that sometimes we just don't match up, because there's a good chance that that person is seeing a specialist that I have no knowledge about. Or if I was the person to refer them to, they prescribe something I have no knowledge about. And so I want to make sure that we're on the same page. Also, hey, if I say, let's go ahead, let's draw some blood. I want to see exactly whether or not they're anemic and they're feeling fatigue, whether or not their vitamin D level is low, whether or not they are diabetic. That leads me to the yearly vision exam. Once again, don't cheat yourself out of a bi-yearly dental exam nor a yearly vision exam. Highly important, because diabetics not only have problems with nerve pain in their hands and their feet, but also if their blood sugar is just that elevated, it can compromise their vision, which in turn can compromise their walking as well as their balance. And so after I've drawn the blood, sit down once again, talk to them, and then I will say, hey, listen, my goal is to have you be as safe as possible, but not only with medications and physical, but also safe at home. And that's when I will refer to an occupational therapist. I'll refer to a physical therapist for strength and balance exercises, an occupational therapist to come in, maybe do a home safety check. That is the thing. Stay in contact with me. I love to see my patients. I love to know what is going on with you, because if you don't tell me, I don't know. So let's look at the myths and the truths. I mentioned falling is something normal that happens as you get older. Well, that's a myth, because falling is not a normal part of aging. Strength and balance exercises, managing your medications, bringing your medications into your to your primary care appointments, having your vision checked, making your living environment as safe as possible, they all equal what? Safety. Safety to prevent a fall. Let's look at the second myth. If I limit my activity, I won't fall. Well, that's a big myth. How many times have we seen a senior just kind of sit in one place? They don't move very much because they fear, you know what, if I get up and I start moving about, then there's a good chance I'll fall. You know, performing physical activity can actually help you stay independent. But guess what? You have to make sure that, or I have to make sure that you have the strength and the range of motion that will keep you as active as possible. Remember, social activities overall are pretty good for your health. And the last myth and truth, using a cane or a walker will make me more dependent. Well, that's a myth also. Listen, folks, walking aids are very important, not just for the older adult, but anyone who is compromised in their mobility. it actually, believe it or not, helps you. So don't turn aside. If someone says, "Hey, listen, let me write you out a prescription for a cane or a crutch, or even let's say a rollator, you know, the little walker that has the seat on it." Those are all devices that are meant to keep you safe. So that's the end of my presentation. The next speaker will be Dr. Jensina Montgomery on medication and falls.
Good evening. I hope you all are enjoying the past two sessions on falls. I am going to speak today on medications that cause falls in older adults. There are several classifications of medications that cause falls in the elderly. The previous speaker, Dr. Staples, she spoke extensively on them, but I'm going to touch on them specifically. She mentioned like mood stabilizers and anticonvulsants. She mentioned gabapentin, Neurontin, which most patients are familiar with, that they take for nerve pain or for neuropathy. Diabetics have problems with their feet with neuropathy, which also these type of medications affect the brain. Antidepressants, commonly known as sertraline, citalopram, escitalopram, paroxetine, and fluoxetine, which is known as Prozac. Several of the elderly, they are commonly prescribed benzodiazepams, known as lorazepam, diazepam, temazepam, alprazolam, Xanax. People know Valium, which is diazepam. Those are a lot of medications that the elderly take to, say, calm your nerves. We have the non-benzodiazepam, the prescribed sedatives, they call them hypnotic, commonly known as Zolpidem, Ambien. Those are some of the main drugs that are normally prescribed for the elderly that affect the brain. And when you take medications are prescribed that do affect the brain. That's where you have the side effects such as dizziness, little off balance. She talked about blurred vision and confusion. All these side effects that are caused by these medications will increase the risk of falls. Also, you have medications such as the opiates, the oxycodone and the hydrocodone. It's also used by younger adults, people who've had injuries, car accidents, falls, or whatever. These medications will affect the brain and can increase the risk of falls. Helena, she also tapped on those over-the-counter medications such as Benadryl. Benadryl diphenhydramine is one of the most common over-the-counter medications that are contained in sleep aids, like your Simonix and all those. That is Benadryl, and the main side effect is a sedative. It's a sedative. It's antihistamine to help with itch, but it's also used as sleep aids, and especially in the individuals that are in the nursing home. That's one of the main sedatives that they use. And one of the medication class I want to focus on is antihypertensive, blood pressure lowering medications. In our families, we can count, there's so many individuals that are affected by high blood pressure, and the doctor is trying to monitor your blood pressure, trying to get you on the right blood pressure medicine. And one of the major side effects of a blood pressure medication is orthostatic hypertension. That's where your blood pressure is low, and you're laying down or sitting down, and then you stand up quickly, and all of a sudden you feel really dizzy, and you're lightheaded, and you may lose your balance and fall. So those are the medications that we really need to get a checklist, look at your bottles like she mentioned earlier, and all of your over-the-counter medications, your herbal, all of those. And also she mentioned the polypharmacy, where you're going to Walgreens, you're going to CVS, or you may go down to the home pharmacy down in Frenchtown. Always make it a practice to participate at one pharmacy so that all the database of all the medication that you're taking is on record, so that the pharmacist can review the drug interactions. If it's a level 1 or level 2, we can contact the doctor that's prescribing the medication. She also mentioned that if you don't bring all your medicine, or you don't have that conversation with the doctor, letting them know, well, Dr. So-and-so prescribed this for this, and I got this from this doctor. That's polypharmacy. That's where you get all these different medications. You're taking it, and you're going to have a mishap, and which can increase your chances of fall. Next. Okay. All right. For prevention, what we're saying is what do you do if one of your relatives take these medications? You're going to, just like she mentioned earlier, you're going to consult with your healthcare provider. You're going to bring those medications in, and you're going to have your medication profile reevaluated. And if there's some changes are needed, the healthcare provider can develop a patient plan for you. They'll stop the medication when possible, switch to a safer alternative, or reduce the medication to a lowest effective dose. Implementing a strategy includes those non-pharmacological options to manage the condition and address the patient's barriers and to reduce the risk of falls. She hit it. Next. Also, connect with your pharmacist. Cheryl, on her website, you can find there's a form there that the National Council on Aging has provided, that you can go online and print that, and you take that to your pharmacy and speak with your pharmacist so that they can help you complete the form. Like Helena was saying earlier, just bring in all of your medications to your doctors, or you can just bring it to your local pharmacist and have them review it and go through which ones that may cause your risk and falls. The next speaker is Bernard Smothers.
Okay, good evening. Again, you can submit your live questions via Facebook and Zoom, the chat box on them, and additionally, you can call in at 850-727-0125. I'm going to be speaking on balance and the part that it plays in falls. Okay, balance, the main inputs to balance will be your ears, your eyes, and the sensory organs in your legs. And they're all integrated by your nervous system, your brain, and the different nerves that run throughout your body. Balance is the ability to maintain your center of gravity, that is to say, the middle of your body, where half your weight is in front of you and back of you, side to side, and up and down. It's the ability of you to maintain your center of gravity within your base of support. Okay. When your center of gravity goes outside of your base of support, that's when we experience those increases in falls. When we first learn, next slide please, when we first learn to sit up, stand, and take our first steps, we develop different strategies for not falling, okay? Those strategies being, and we're on the next slide, please. Those strategies being pushing with your toes, which can go a little bit too far forward, or spreading your feet apart, keeping some distance in between them to keep from falling from side to side. When our toes can't keep us from falling, Then we'll bend our knees to bring our center of gravity back within our base of support. And when those two don't work, then we wind up taking a step or two to try to get everything back in line. Next slide. Other strategies that we use when we're a child, when we're first learning how to walk, is like holding on to things such as furniture or walls. Again, spreading our feet wider apart, and even asking for help when we don't feel that we'll be successful in walking that distance. And the next slide, please. As we get older, we experience illness or accidents which may cause us to lose the ability to do the things that we learned as a child, the things that we integrated into us that we don't even stop to think about that we were doing. We may get weaker, our legs get weaker, our eyesight gets worse, we experience changes in our ears, our nervous system, we process information slower. And so now we have to come up with different strategy, or even go back to those earlier strategies that we learned when we were a child to be able to walk and not fall. Final slide. Okay. In regards to decreasing strength, the better thing to do with that is to be proactive about that, to exercise on a regular basis to try to maintain our strength up. When we can walk, if we've lost that ability, walking increasing distances from day to day, walking on varying surfaces, uneven surfaces such as grass, sand, and dirt that sit up there and challenge our legs and our muscles, walking up hills to try to build our strength. And it's going to take a little while to get back up there, but exercise is one of the key factors in maintaining our strength. Changing eyesight, check the prescription in your glasses and wear them, okay? Improve the lighting in your home, which was pointed out earlier. Walking in the dark, try to minimize your walking in the dark. Put lights where they're easily accessible to you, and place brighter colors inside your environment so that your eyes can focus on them, so that you can judge distances better. Changes in the ears, okay? Use a cane or a walker, hold on to things as you walk, such as sturdy furniture and the wall. You can strategically place them inside the house, or put in railings, that type of thing, to try to facilitate holding on to them and improving your ability to go across your home and about without falling. Take wider steps, that is to say with your feet wider apart, not longer steps. Again, one of the strategies we used when we were younger to try to prevent ourselves or preclude us from falling itself. And again, practice walking on grass, sand, dirt, that type of thing, to stimulate the proprioceptors to try to get them. And such things as rocking in a wheelchair or swinging in a swing also will help as well too, as far as stimulating the balance receptors in the lower organs in the head and everything, to try to improve your balance and keep you from falling. Finally, as we get older, we have more information in our heads from life experiences to sort through. And yes, this takes longer. As such, take your time when doing things. It'll get done when it gets done. Next, you'll hear from Sherry Lyles, a social worker.
Hi, everyone. Don't forget, if you have questions, you can enter your questions on Facebook or Zoom in the chat, or you can call in at 850-727-0125. I'm a social worker, and today I would like to take a few minutes to discuss with you the role of the social worker as an integral part of the healthcare team. I would like to discuss fall prevention and how social workers are beneficial to providing information on available resources within the community. Social workers generally do what is called a psychosocial assessment, which is an evaluation of an individual's mental health and social well-being. It assesses the perception of the individual's ability to function in the community. In short, it's a screening tool. By providing this assessment, social workers are identifying needed referrals based on the assessment. Identifying the needs allows us to have more proactive approach, which allows for prevention, of predictable risk. Being independent is valuable to most of us. The comprehensive assessment reviews the following items: demographics, your memory, your general health, sensory, and communication, activities of daily living, which is how much assistance is needed for the following tasks, such as bathing, dressing, eating, using the bathroom, transferring, walking. And then there's the instrumental activities of daily living. How much assistance is needed for the following tasks, such as heavy chores, light housekeeping, using the telephone, managing money, preparing meals, shopping, managing medication, and transportation. Also, we look at health conditions and therapies, where they are providing information on the frequencies of current therapies and specialty care, mental health status, living environment, nutrition, review of meds, including over-the-counter medications, and if there are any substance abuse use. And then your social resources. Is there someone besides the primary caregiver who could help? How often do you talk to others? Spend time with others and participate in activities outside of the home that interest you. And then there's the caregiver. We discuss who is providing the care for the individual and how much care the caregiver is providing. Upon completion of the assessment, this assessment can provide the elderly individual a plan of care for the services that are needed in the home to prevent falls and social isolation. If the individual does not have a social worker who can assist them with obtaining community resources and support in the home, they can reach out to the Elder Helpline at 1-800-963-5337, which would be your starting point to receive general information. Some of the other programs that can assist in the home, but not are all inclusive, are Ability First. Ability First, they have resources for individuals who are not able to purchase supplies or equipment. They have loaners, as well as elder care services. They can also assist with individual needs for items like supplies and equipment and other resources. And also there's your local senior center. A lot of elderly individuals go there for social activities. So if you need a referral to therapies like occupational therapy, you can speak with your primary care provider. And that concludes my portion. And our next presenter is Barbara Kornblau.
Thank you. I'm Barbara Kornblau, and I am an occupational therapist and an attorney, and I also am an educator. And I'm going to remind you that if you have a question or a comment, you can submit it through the chat box on Facebook and Zoom, or you can call 850-727-0125, and a representative will submit your question to the panelists. Next slide, please. So I'm going to talk about 3 laws that are very helpful to you if you are trying to stay living independently at home and safe and from not falling down and all kinds of things. The first one is the Fair Housing Act. Now, a lot of people know about the Fair Housing Act and what it does for, to protect from discrimination, from racial issues, and from, different ethnic groups and things like that. But a lot of people don't know that the Fair Housing Act was amended at some point, and it's to include people with disabilities, because people with disabilities are often discriminated against as well. Some, apartment buildings may not want an older adult there who uses a walker. They just want youngins there. They don't want it to look, it looks like a nursing home or whatever, which it doesn't. We're staying independent and we're staying in our homes. So the Fair Housing Act allows us to do that. And it does several things. It says that they can't discriminate against you because you have a disability. So because you walk with a walker, they can't discriminate against you. But they also have to allow modifications to your apartment to keep you safe and in your home. Now, I'm going to talk about a different law in a minute called the Americans with Disabilities Act. One of the differences between that law and this law is that this law, the landlord doesn't have to pay for the changes, but they have to allow you to make them. And let me give you an example. Mrs. Johnson lives in an apartment complex, and she walks with a walker. She broke a hip, and she wants to go into the pool every day to help promote healing and increasing her muscle strength. And in order to get in the pool, some volunteers from her church have offered to come and help her in and out of the pool because she can't get in and out of the pool herself. She also there's an issue because the complex doesn't allow visitors during certain times. So on weekends, they don't allow visitors to come in the pool. So Mrs. Johnson says, you have to change that policy for me because I can't use the pool, which everybody in the apartment complex is entitled to use, unless I have someone helping me. And I have people coming to help me from my church. So you have to change your rules to allow me access, like everybody else, to the pool. So that's what they have to do. They have to allow her that accommodation. So they have to modify their policies and practices. Another change they would have to do for her is if she needs grab bars to get in and out of the bathtub, they have to allow her to put the grab bars in. They don't have to put them in for her, but they have to allow her to put the grab bars in her bathroom, in her unit where she's living. Now that may mean in some situations they are allowed to ask for a deposit to put things back the way they were. They may not be able to do that with grab bars because you can't really take those out. But there are certain things that you might make changes where they say, give us a deposit so when you leave, we can put it back the way it was. So what this does is it could be the difference between somebody going home and falling. If you're worried you're going to fall and you need grab bars, you can have them. Or someone coming out of a nursing home, maybe someone fell and broke their hip and they want to come home, but they're worried they might fall again. They need that grab bar. They need a raised toilet seat with grab bars by the toilet seat. The landlord has to allow you to put those in. And that can be the difference between independent living and having to live in a nursing home or some other type of, congregate housing that you don't want to live in. You want to live in the place you've been living your whole adult life. You're allowed to do that. You're entitled to do that with some changes that they have to let you make. They also have to let you make some changes to the common areas as well. So if you have trouble opening the front door, they may have to put a button in that makes it automatic. These are some of the things you need to discuss with them because there may be access to common areas. So some apartment complexes have a cafeteria or a restaurant on the first floor that's open to the public. They have to give access to that. That takes us to the next slide, please. Next slide, please. And that's the Americans with Disabilities Act. Now, the Americans with Disabilities Act, this requires owners of public places to make them accessible and usable by people with disabilities and mobility issues. So let's say you live in an apartment complex, and on the first floor of the apartment complex, there's a restaurant that's open to the public. So that becomes a place of public accommodations. And the difference is that now if you need that bathroom has to be accessible and they have to pay for it. So they have to have an accessible stall in the bathroom with grab bars and everything else. The door has to be something that can be opened, or you can request that they put in an automatic button. So they have to make the facilities accessible, and the difference is you don't have to pay for them. That's a requirement. Now that can apply at the mall, having to put in parking spaces. They may say, oh, accessible parking's over that way. It's like, no, I want to go to this store. You need to have accessible parking near this store so that I can park there. So that's what the Americans with Disabilities Act does. And what does it apply to? Everything. Every place you go, movie theaters, stores, grocery stores, hotels, doctor's offices. Now, one of the things that you may find that we're working on this, we're advocating for this nationally, is accessible medical equipment. If you need a pap smear and you can't transfer onto that table, you may never get a pap smear. And I became involved with this because I have a a client of mine who died because she was 31 and she was bleeding and no one would do a pap smear. And I went with her to the doctor. I transferred her and she had stage 3 cervical cancer and she died 6 weeks later. We are advocating for this nationally. They came out with accessible medical equipment standards, but they didn't make them mandatory. They're voluntary. And hopefully going forward, politically, whatever, we can do more advocacy and we can get these made permanent so that you want to get weighed, you can get weighed. If you're in a wheelchair, they can weigh you. When I worked for a senator and someone wrote to us and said that she wanted to get weighed and the doctor told her to go to the post office and ask them to put her on a male scale. Well, that stuff's going to end. People aren't going to say stupid stuff to people. You know, if you need to get, you know, various types of exams, if you need a colonoscopy, and one gentleman did all the clean out for colonoscopy. And if you're an older adult, you know what I'm talking about. And went to the doctor, went to get it done. And they said, oh, we don't have a way to get you onto the exam table. So here's a stool sample cup. No, that's going to change. They have the standards. They decided what medical equipment is supposed to be accessible. And we just need to make it mandatory and not voluntary. And this is important because you want to live, you know, you want to follow the guidelines and have all of the tests that you're supposed to have. You don't want to fall trying to get on the table at the doctor's office. You want to get weighed. You want to be treated like everyone else. Okay, next slide, please. Now, the last law I'm going to talk about is the Rehabilitation Act. And this one requires that anybody who receives federal funds has to make reasonable accommodations to provide access to people with disabilities. What does this mean? This means that theoretically, they can't not give you a pap smear if they're getting federal funds, if they're getting money from Medicare, if they're getting money from Medicaid, if they're getting grant money for various experiments and studies they're doing. They have to treat you and provide you with the same things that they provide to everyone else. So this is something, it's a good way to go after places that are not, you know, serving you because you don't meet their standards. You know, we want people, everybody that can walk is easy to treat. You know, if I'm a doctor, I want everybody to be walking and able to follow directions when I tell them and able to do what, you know, all that stuff. But that's not how people are, and especially as we age. So they have to make their reasonable accommodations means they have to figure out a way to get you on the table. They have to make it so that you can get into the building. If the building has steps, they got a problem because you're entitled to access to that doctor's office or whatever it is. They have to figure out a way to give you access. So if any of these things are problems, I think there's going to be a contact at the end of how you can contact Kavana, and we can give you some referrals to some places that can help you with this stuff. And on that note, I will turn it back to our host, or hostess.
Wow, those were great presentations, right? Now's the time in which you can get engaged. Remember seeing on the screen the 3 ways you can contact us with questions? Well, bring them on in. And we have some questions now, so I'd like to go over a few. The first one is for Leah. This is an anonymous question. I feel like I need someone to come see me for a fall assessment because I'm fearful of falling because I've fallen before. How would I get started?
You would want to contact your physician. Your physician could give you a referral to occupational therapy so that an OT can come out and give you the evaluation and assessment that you would need to determine your risk.
Thank you. I have another question. This question is from Stephanie. What are the symptoms that you identify to request a PT consult for outpatients? I think that would be for Bernard.
I'm sorry, could you repeat the question again, please?
Sure. From Stephanie, what are the symptoms that you identify in order for you to request a PT consult for outpatients? I get the feeling this person is a healthcare provider.
Okay. As a healthcare provider, they're going to more or less focus on the frequency of falls itself. If it's just one isolated fall, it wouldn't be much of a problem. But if there a frequency of falls, if it's increasing gradually over a period of time, that would be the main symptom right there. Other things, well, those components that feed into you maintaining your balance, as I said, would be the ears, the eyes, and the legs. And so any problem associated with those, if it seems like it's linked to them falling, the highlight deficits associated with them.
Thank you, Bernard. I have another question. This is an anonymous question also. I think this is for Elena. How will I decide if I should call my doctor's office or go to the emergency room after a fall?
Ooh, that's an excellent question, because there are several individuals who will say, nah, it'll go away, the feeling will go away. Well, one is that the first thing that you notice is extreme pain, because the extreme pain can mean either it's a bad sprain or a broken bone. If you're not able to move that limb, if you're not able to move the leg or the ankle or a particular toe, that's another thing that will send you straight to the emergency room. Some individuals will stay and put ice on a limb that is swollen. But if something swells up and it turns almost like a black, blue, and almost like a pinkish color, I would head straight to the ER. But some individuals don't want to go to the ER for whatever the reason, be it a lack of insurance or they had a bad experience there. So they will doctor themselves at home. They will apply the ice for the first 24 hours. Taking ibuprofen, that actually helps with the inflammatory process. And so if that does not work, first 24 hours, if you are in such extreme discomfort, you really do need to seek emergent care.
Thank you, Elena. The next question is for the pharmacist. How would I contact my pharmacist to help me with the medication sheet that you talked about? They always seem so busy when I see them.
Hello. Yes, you should be able to contact your pharmacist at all times. But if you decide that you want to speak with them one-on-one, you can call and schedule, find out with your pharmacist and schedule a time. And they'll feel very, happy. We're always open. And that's one part of our profession, is just not being on the bench filling prescriptions. We're also there to counsel the patient. So we'll make time for you to answer your questions. So just feel free to call your pharmacist and try to just set up a time that they can meet with you, and they'll go over your medication.
Great advice. I have another question. This is anonymous questions. No one wants to say who's asking the question, but that's fine. This is for Barbara. I live in an apartment and heard you talk about my rights as a tenant with the Fair Housing Act. How do you suggest that I speak with my landlord about my needs? I don't want to lose my apartment and have nowhere to stay if they get mad at me for asking.
Well, if it's kind of like this too. If they get mad at you and they threaten to kick you out, that's violation of the Fair Housing Act too. And one of the nice things about the Fair Housing Act is anybody can file. You just go online and you look for housing and urban development, and you can file a complaint. So if there's something you want, just talk to them and say, I'm interested in, I want to put grab bars in my bathroom. So I'm just letting you know. If you have, any requirement, let me know, and, That's where we're at. And then if he gets mad, you can't do that. You just say very nicely, oh, you must have heard of the Fair Housing Act. I'm surprised that you would say that because you're such a good landlord. And you know, under the Fair Housing Act that you have to let me put grab bars in. So that's how I would handle it. And if they, if there are any complaints about, if they threaten you or anything, you can just complain to the Department of Housing and Urban Development, Fair Housing Act stuff.
Great. Another question for Mr. Smothers. It's COVID, and I'm in the house all the time. I move around the house well, in my opinion, but want to reduce my risk of fall because I'm 79 years old. What can I do in my house safely to work on strengthening balance until I feel it's safe to go out again?
I would say, I'm sorry.
No, go ahead.
I would say there's a variety of things that you can do. And actually, I kind of target people to going outside and just walking out around their house itself. But inside the house itself, there's leg weights, there's marching in place, there's just pushing up on your toes and back down while holding on to a chair, that type of thing. There's exercise bikes and steppers and things, exercise equipment that you can actually bring into the house environment itself to facilitate maintaining your lower and upper extremity strength.
Okay, I have another question from Anita, and I guess anyone can answer this and may piggyback off of the one we just had, but it says, does anyone have any recommendation for as it relates to working out as we get older? Will this help maintain my balance? I guess going to the gym, does that help with your balance by going? Anyone can answer that. That's not all step. Bernard, this is you. Go ahead.
Maintaining your balance. Again, I focus on the fact that the inputs for balance are going to be your eyes, your ears, and your lower extremities. There's the sensory perception in those. And so anything that causes you to use those is going to help to maintain and improve your balance itself. I pointed out rocking chairs, okay, and swings, just going back and forth, which would tilt the head back and forth. Just getting up and walking or walking on uneven surfaces, grass, sand, rocks, that type of thing. If your balance is bad to begin with, you may want to use a walker or a cane. You can still get a benefit from walking on uneven surfaces, even using an assistive device of some sort.
Thank you.
I would even go as far as being that she's 79 years old, access the senior center. I use the senior center as a great referral source because now with there being COVID-19, the center isn't open, but they have wonderful programs on Facebook that you can access. Yoga, there's Aging with Dignity. That's a great source. And there are people there who walk and talk and possibly look like you. So, they have great senior programs, Tai Chi that works on the balance. So those are, your senior center is a wonderful place. And there are different senior centers all over Tallahassee. There's the main one that's on North Monroe. There's a senior program at the Lincoln Center, one at Smith Williams, Bradfordville. So I would definitely, you lived 79 years. That's a wonderful thing, and you want 79 more. So definitely access those programs.
Thank you so much, both Bernard and Elena, for those suggestions. As we wrap up for the evening, we may not have been able to answer all of your questions. For the sake of time, however, we do want to hear from you. If you have questions that did not get answered this evening, send us an email by going to our website, which is CavanaughConsultants.com, Click on the Contact Us tab at the top of the page and send us a message. Also, when you send the message, include your best phone contact information in the body of the message, because we may need to get back with you via telephone. You're also welcome to write us with your question. Next slide. Because our address is displayed here, great. Our address is listed here, 625 East Tennessee Street, Suite 220, 220-1 in Tallahassee. Feel free to write us. Those who are not actually technologically savvy and would prefer to write us a letter, we're okay with that. We welcome letters. Remember, you can find the medication sheet on the website under patient resources. There have been several behind the scenes staff and volunteers that have helped bring this event together. They're acknowledged here. We'd like to thank all of them. I hope you found this experience informative because we enjoy preparing for it. Please look forward to other educational community offerings from us. To keep informed on what we're doing, like Kavanaugh Consultants on Facebook. And for later reference, a recording of this presentation will be available. Check back on our website for further details. I'd like to thank you this evening for coming, and have a great evening. Goodbye.